don't always shop for the cheapest prices because it is your face, it is your body. Make sure that you have a licensed practitioner. You'll be okay. You'll be good, So you really got to look at those things. My medical license, my board certification, and the years I've been practicing does really set me apart.
Welcome to the Faces of Riverside 2026 magazine conversation series, where we get a chance to showcase some of the individuals that are highlighted and featured within the magazine itself to learn a little bit more about who they are, what they do, why they love what they're doing, and why folks should be having conversations with them as well. Today, we're fortunate to be joined by Michelle Garcia from Fun Aesthetics here in Riverside. Michelle, welcome.
Thank you, Norm. Thank you for having me today. And hey, fun babes, because that's what I usually call my patients and address them on Instagram.
Is that right? Fun babes?
Fun babes. Yes.
Okay.
And I should tell you too that fun means feel unbelievably new. That's what fun means.
I was not aware of that. Okay, so I assume you chose that name simply because
I chose it. Oh, I'm sorry. But
No, go ahead.
And it took me way back about 20 some years ago when I started. It took me all night. And I would always tell my patients, you know what? This is so fun. I have such a fun. I have such a good time. I love doing this. It's fun to me. So then one night I stayed up all night and I was like, what do I call myself? What do I call myself all night? And finally I was like, you know what? It's going to be fun because I always say fun. So feel unbelievably new. And when people come to see me, my wish is for them to go away or to continue with me through the years and literally feel unbelievably new.
I love that. That's
Yes.
great. So you mentioned 20 years. So let's go back 20 years in a day. For folks who don't know you personally or professionally at this juncture, can you share a little bit about your background and what led you 20 years ago to start Fun Aesthetics?
Well, I used to serve people in the family practice setting. Okay. So I would see I would see men, women, children. I loved it. It was really great. And what happened was I would used to send my patients out into other specialties to figure out some things, rashes, some kind of things. And this was way back before aesthetics was what it is now. Okay. We weren't doing it to this point, like a practice on every corner, right? 9 times out of 10, my patient would come back to me. And this is the true story of how I started. And I'd be like, okay, well, what did they say? Hoping like, oh my gosh, we have the magic answer. It's going to be fixed. And they'd be like, oh, well, they sold me a package of chemical pills. I'm like, okay. So continue on. Well, what did they say? The next person, oh, they told me to start these creams or this and that. And so this would happen so often to me. And I started thinking, wow, why am I sending my patients out? Like, I could do this. I need to start researching and start gaining that knowledge. And I could start helping my patients, whether it was kids with acne or it was women that had pigment or, what rashes, whatever it was. And that's how I got the idea to start this Fun Aesthetics part. That's
Okay.
the honest truth.
Okay. So can you talk a little bit about your credentials or what
So
qualifies
I'm
you?
a physician assistant, and I'm board certified in family practice. And before that, I was a respiratory therapist for 10 years. So I've been in medicine, honestly, for about 35 years. It's been a long time. I also now specialize, of course, in aesthetics and the latest laser trends. I've had a lot of training, and I happen to also be a master injector. I do offer training, and I do train for other companies as well. I train other nurses and providers on how to inject and do the things that I do. So
Okay.
that's a little tidbit to know about me.
Yeah, that's important. It's one thing to do it. It's another thing to be able to teach it. So that speaks volumes.
And I love to teach. I love to give that knowledge. I love to mentor. and I just love to serve. My heart is in service and teaching and mentoring. And so this kind of a practice for me is not a far stretch at all.
Okay, so you mentioned something that I kind of want to touch on. You implied that there are organizations or businesses like yours on every corner.
Right.
And I agree. I certainly see them all over the place now. And I assume that one of the drivers for aesthetics, there are a couple of them, and it comes down to trust, results, and experience. Because most people that are considering the kinds of services that you offer, they're really concerned about who can they trust with their face and body. So I kind of want to delve into that just a little bit. Before I do, can you describe for me or to a new prospective client what Fun Aesthetics is all about? What are they going to experience when they walk through the door?
So we're all about being kind, being having you in a comfortable environment. And I feel that the average person can walk into my office and feel comfortable. So that's what you would feel. You shouldn't feel like, oh my gosh, I can't go there. Everybody just looks too beautiful or fake. No, I mean, we're real people. Our desire is to help you achieve what that desired outcome is that you have. And we really want to serve you and help you to feel better about yourself, actually. Not even just appearance wise and physically, but on your inside too, because it really matters how you feel inside and your self confidence. So I really strive for that. And I also teach my staff to be concerned about the person's whole being, not just the outward physical appearance, because we can get so stuck in that it's super important for us to connect with that individual as well.
Makes sense. So, in terms of the services that you offer, you have a pretty wide range of services.
We do. Yes.
And I'm wondering what some of the more popular treatments are. And let's start there.
Okay. Some of the most popular treatments are for sure, hands down, Botox. Everybody wants a little lift, a little refreshing. Botox is amazing. Anyone can do that, men, women. I could see somebody in as soon as 18 or 19, for some toxin. That's not unheard of. Many years ago, it was mostly a mature person kind of adventure, but now the age is very young as well, to do that. So Botox, I would say microneedling is very hot. It's a very low entry type of procedure, but it yields lots of results.
What
So
is that?
microneedling is a medical grade device and it has needles on the tip of it. They're sterile. It's one per use per patient. And that's really important. You can't reuse those. And that kind of just opens some channels in the face and it helps with acne scars, with tightening the face, refreshing up. It turns your collagen and elastin, gets it going. So you kind of are turning the hands of time back. So that's very popular nowadays too. As well as on the other end, laser resurfacing. That is one of my favorite things. One of my favorite things to do is to create and do procedures together to get the best results to achieve that. So that's one of my specialties, I think.
Okay. So, is it safe to assume, and forgive me if I'm wrong, but is it safe to assume that when a potential client walks through the front door, they know what they want to address in terms of their face or whatever the case may be. They have an issue.
Hmm.
But because of the wide variety of services that you offer and your areas of expertise, how do you help them arrive at what's the best solution? And I realize that varies based on why they're there in the first place, but I would imagine most don't come in knowing exactly what they should do to solve a very specific problem. So what's your process for evaluating that and helping them?
So you're correct in saying that. I do offer a wide variety of services, but as well, there's so much on social media. There's so much buzz going on about different lasers, different procedures. So my job is to help them home in on what it is that they're really wanting. Sometimes patients don't even know exactly what they want or what area. They just feel like, Michelle, I just feel tired. I feel worn out. I feel like my face is saggy, in general. So my approach is to sit down with them. I like to give the patient the mirror and we talk at the same time as they're looking at their face. So that way we're both in tune. We both are seeing the same thing, and then I can address that, and then our expectations are the same and we're on the same page. So that's really important to me. And I'm never going to have I have patients that sometimes come in, and my patients know this, and they'll be like, "Well, you tell me." No, I don't like that. I won't. I feel like it's really personal, and together we will both curate a plan that we both agree on and that can give us our best results. And that's the way I approach it.
So when they come in and they're not necessarily exactly sure as to what they want or what they think they need,
Mhm,
and you've had a chance to have this consultation with them,
mhm,
I think is what you're kind of describing.
mhm.
Are they Do they typically leave, or do they typically receive the kind of treatment they imagined they would need? Or is it common that maybe there's a better solution to their problem and they walk out kind of surprised that that was the method to use?
I didn't What do you mean leave without having treatment? I'm
Well,
confused.
so sorry. So if somebody walks in and they say, I need a laser peel. And you, rather than just kind of accepting immediately that that's what you're going to do or recommending that, right? So you're going to have a conversation with them through this consultation. And you're going to come up with some other alternatives, perhaps that might better serve what they're trying to accomplish. Is that
Yes.
is that fairly common, or do they typically walk out with what they had expected?
It's fairly common. I mean, we need to come together, and I will, if they're set on doing that particular procedure, that's fine. But I'm always going to give you that's my job. My job is to inform you, to give you the knowledge, to make an empowered decision, right? And then I will present to you the options, and then it's your choice. So that's how I
Okay.
approach that. But I always want to work with the patient, make them happy, and come up with a plan that we both are happy with and that's feasible. And I know that we can attain that. We can achieve what they're looking for.
Okay.
I'm
So is there?
definitely not going, oh, sorry. Sorry. I didn't mean to. But
No, go
if
ahead.
someone comes in, and I think maybe you're asking me this and now I get it. But if someone comes in and they say, oh, I want this thing, if that procedure or that thing that they're asking me for is not for them and they're not a candidate, we're not going to do it. Were you
Okay.
asking me? Okay. Yeah.
That's exactly right.
No, no.
That's exactly right. Okay. So they're always going to walk out with the best recommendation to
Yeah,
achieve what their ultimate goals
yes.
are.
But just because someone comes in because they've researched it or saw it on Instagram or whatnot, doesn't always mean that is the best thing for them. And I want to do the best thing for that person. It's so very individualized.
Sure. So of the folks, so you have a lot of folks coming through your front door. What would you say is the most common concern or goal that those folks walk through the front door with? Is there one thing that tends to stand out more than others in terms of?
Yes.
Yeah.
Yes. So the most common thing that I get is, Michelle, I don't know what happened. All of a sudden, I looked in the mirror. It's like I woke up and I just look tired. I look tired. People keep telling me I look tired. My eyes look, puffy or droopy. That's like something that I get very often. It's like I don't know what happened. It happened like overnight, it seems. And that's
Okay.
very yes.
Is this type of treatment, and forgive me for not knowing, but are the types of treatments that you do, are they something that are covered by insurance or something that most folks have to pay out of pocket?
No, these are elective procedures. So it's
Okay.
going to be 100% out of pocket. But I will say that there are a lot of things that are covered by like people's FSA and HSA plans. So if they have that, then we do accept that as well. But it is coming from your pocket. So I understand that. And I'm always grateful and thankful that I have a practice, that I have patients that have stuck with me for 20 plus years. So I always will always do my best to serve and to find the best solution for my patients.
Okay. Okay. So ideally, then it sounds like anyone coming through the front door has to certainly be able to have some discretionary income and be able to afford this
Yes.
type of procedure, right?
Yeah.
If they're, um, are Are there lower or higher cost options for them? In other words, if there's somebody who walks through the door who just cannot afford a laser peel, for example, and forgive me for keep using that as an example, but it's one of the few that I know. Do you send them out the door with ideas if they cannot afford it themselves, things that they can do?
There are many things. So, one thing that I kept in mind all those years ago when I did start my practice is I wanted there to be something that the average woman can come in and afford to do. So, there are many things that you can get at a pretty affordable price point that will make a change, you know? And I also do offer medical grade skincare, and that alone will make a great change. So, if someone's going to come in and maybe they can't afford the procedure that they like, okay, well, then let's start here. Let's start maybe with a chemical peel, or let's start with a light peel. Let's start with some medical grade product. You know, there's treatment for acne, weight loss, hair growth, IV therapy. There's many things that are very obtainable at a reasonable cost that's not thousands. And then there are those regenerative procedures and laser resurfacing procedures that, you know, do have a higher price tag on them. So I feel that in my practice, there is a wide range for people.
Okay, let's talk about your team for a second.
Okay.
You mentioned team.
I
So
love
one
my,
of the
yes,
yeah,
sorry.
great, no problem. I love that you said that. So, what's the makeup of your team? Are you doing all the procedures yourself, or do you have other experts that are there doing them for your clients?
I am not doing all the procedures myself, but I do lead my team and I train them myself. And I have three nurses, three RNs on board. And then I have two assistants and I have a receptionist. So my receptionist, I like to mention, she's been with me for, I don't know how many years, like probably 13 or 14 years. Everybody knows Susan. Everybody loves Susan. I don't think I can run without her because she knows everyone by name and she chats with them about family and about daily life. And she's like my secret weapon, actually, I think. My nurse, Annabelle, she's been with me for 11 years. And great story about Annabelle is when she came to me, I'm real huge on education and encouraging that as well. And we can get to that after this, but she came to me. She was a medical assistant and she's wonderful. She's so smart and would assist me well and do, and much to the detriment of myself because she's the best assistant I ever had. She went back to school and she still worked a little bit at the same time, but she became an RN. So I'm happy to say that Annabelle is still with me. And so there has been my next nurse, Abby. She had been my patient since she was in junior high. And so she also was my daughter's horse trainer. And now she's an RN and she's with me as an employee. So, I mean, there's a unique story behind every single one of my staff.
So, obviously, trust is a super important part of your business as a whole, and it
Mhm.
speaks volumes that you have staff that has been with you for years and years. Turnover, a lot of quick turnover would be kind of scary. It's something that I would be concerned about. So that certainly speaks volumes. You mentioned education. It's one thing to learn how to operate a machine or how to apply for all the different types of services that you offer. I assume, however, that is a constantly changing and growing. Right. So talk a little bit about ongoing education. What does that look like? Is that something you as well participate in?
Constantly. I'm constantly taking courses online, going to conferences, letting my reps lead me to more education. It's a constant. It's a quickly changing field, honestly. And you got to keep up. From skincare to changing procedures to changing technology, it's fast paced. And I pride myself in always looking into everything, keeping up, and always trying to stay abreast to the newest, latest thing. Because I always feel like people are always like, "Oh, I'll go to LA or I'll go to Beverly Hills." And I've always tried to bring whatever is new and cutting edge here to Riverside. So something about myself is I was born and raised here in Riverside, went to school here, everything. So I serve here in Riverside. And so my heart is very much in serving Riverside and my patients and the people here. And so bringing the best things in for us here in the Inland Empire.
Okay, so the we
I hope
talked.
that
Yes, we talked about in the beginning. You mentioned we talked about all of the other providers that are out there, and I think the more and more that we see, the more and more I think folks are unclear or concerned about the quality of each of those. Can you talk a little bit about how fun is different or stands apart from all the other competitors that are out there?
say that we stand apart because I have been in this industry before it was even this monster industry that it has. Okay. So I've been practicing 20 plus years. And I believe that when I started, there was only like three of us literally in Riverside that did this type of medicine. And I'm a PA, I'm a physician assistant. So I tend to come from a more medical background, and can do a little more and a little more diagnosing and prescribing and such. But, you know, I would say that makes me a great authority in my field and it sets me apart. Am I better than everyone else? No, obviously not. But I would caution people and patients out there, the public, to just be sure that who you're choosing is licensed and they have the proper training and, don't always shop for the cheapest prices because it is your face, it is your body. So those are things, make sure that you have a licensed practitioner, you'll be okay. You'll be good, So you really got to look at those things. But I feel that my medical license, my board certification and the years I've been practicing does really set me apart.
Okay, and your environment in terms of the office itself, can you talk a little bit about what that looks like or how that
Yeah.
might be different?
Our environment is so relaxing and peaceful. We have a large, beautiful green lawn, a big historic riverside home on Magnolia. And I just feel that it's very inviting, very soothing, and it's comfortable. It's comfortable. Most of my patients, we have a little snacks back there and little spa water, but it's very comfortable and inviting. So very proud of the environment and the practice that I have built here.
Okay, so we've talked a lot about a number of the procedures that deal with the face, for example.
Hmm?
But you also do, if I'm not mistaken, hormone replacement therapy. So that's now we're talking about inside of the body. Can you talk a little bit about hormone replacement therapy and who are the types of candidates that are best served by that type of offering?
Yeah, so I do offer bioidentical hormone replacement. And if you're a woman and you're feeling sluggish and fatigued and you just can't get that weight off, can't sleep, oftentimes my patients can be kind of depressed and fatigued and not sleeping well and have a really low libido. If that sounds like you, come on in and see us. We'll draw your blood, we'll look at it, and we'll do a consultation. Now, on the flip side, if you're a man and you're feeling really cloudy and you just don't have that oomph anymore, you're fatigued, you don't have as much energy, you used to jump up and work out, and now, you feel like you're different than 5 years ago, then definitely hormone replacement therapy would be for you. And honestly, it's life changing. I get it myself and it's life changing. So any man or woman out there that is just feels kind of blah and fatigued, come in and see me. We'll look at your labs and then we'll decide what's right for you. Because it may not be right for everyone, but it's definitely a huge tool.
Okay, you described them as bioidentical. Is that right?
Identical hormone replacement therapy. So it's not the same as if you went and took estrogen or anything like that. They're bioidentically equivalent, but more on the natural side of replacing your hormones.
Okay, so help me understand that a little bit more. It is not actual estrogen, for example. It is a makeup of natural
Yes,
components.
it is. It is
Am I getting that?
equivalent, but
Okay.
it is more similar to what we have in our body. Yes.
Okay, and is that kind of a um um is that kind of a product or a treatment that is the same for everybody? Is it like taking a vitamin C pill, or
It's
does it really?
very Go ahead, sorry.
Yeah, well, you're answering it. So does it matter? Is mine gonna be different than the gentleman next to me?
Absolutely. Yes.
Okay,
So that's why I mentioned you come in and you have your blood drawn because everybody is different. It's totally based on your lab results. And then we get your lab results, put it directly into a program, and it tells me exactly based on your specific problem and lab results what I should be giving you. And that's how I
okay,
do here. Okay. And I offer pelleting, where you come in and you get those implanted into the body every 4 months or so. And for men, I offer injections because not a lot of men like that pelleting. They might want injections for testosterone
okay.
and such.
Is that something, so as a man, speaking for my fellow man, is
Mhm.
that something, how often does that need to take place? Is that something I have to do every week or every month or
Every week.
okay, and that has to be done in office?
Well, you can do it in office or you can take it home, either one.
Okay,
But
okay,
I will have you in the beginning coming in to have me do it and have me monitor you. And my patients are used to this. And then once I get comfortable and you're comfortable, then I may let you take it over.
okay, okay. That's I would actually probably prefer that, quite frankly.
Because that's a learning curve, you know? There's a
Yeah,
learning.
sure. So let's talk in general for a minute. And first of all, I very much appreciate you doing this, and I am learning a lot through this conversation. So
Yeah.
thank you for that. In terms of the business as a whole, can you talk about what some of the biggest challenges have been for you along the way, and or some of the biggest rewards when it comes to building fun aesthetics?
So I feel the biggest challenges for me have been admin stuff. That's not in my wheelhouse. You know, my wheelhouse is I want to treat, I want to have some fun with my patients, I want the outcomes. That's my passion. I love doing those things. The admin stuff, the paperwork, all that, not so much my passion. So, that has been a learning curve. It's continuing to be a learning curve, but it has gotten a lot easier for me, honestly. It is.
Okay, and
So,
tell me
yes.
something that's rewarding from having done this. Are there an example you can give of a patient who came in with expectations and when they were done with their treatments or in the middle or in the process of treatments that had just an amazing experience? Some way of distinguishing that?
Two things, two different types. Someone that comes in and you are talking to them and going through the treatment and the transformation of their face. And in the beginning, they're so tearful and depressed and so sad about it. And then by the time we get through, they are tearful, but they're happy. They're very happy. They feel good. They feel renewed. That's so super rewarding. Okay. The other one has to do with weight loss. I've had patients that have lost 50 to 80 pounds. That's life changing. That's life changing. And I'm so honored and humbled to be a part of that transformation for them because you see it in their walk, you see it in their life, you see it in their confidence, the way they carry themselves. Then that's very humbling, honestly. Almost makes me cry because it's so humbling that they allow me to go through this process with them. And it's life-changing for them. Those are the most rewarding things that I do.
Amazing. So if someone is considering aesthetic treatments of some kind,
Mhm.
but they're unsure, they're hesitant, they're fearful, even if they've seen all the social media and all the positive results. We've all heard stories of outcomes not being so great. What would you say to them? How do they get started with you and the team? What do you recommend?
Picking up the phone, calling, and making an appointment. It doesn't hurt to discuss something. Our consultations with our nurses and myself are free, and we can talk about what you can expect, what you can do, and your options. The other thing I would like to say too is when you're going in for a treatment, and whether it's with me or it's with any practice, be sure that there's always an exit plan. Be sure that whatever you're getting done, that person can resolve an adverse event, can stick with you to get it right, actually. So I want patients to be very sure that when they go get a certain procedure done, that there's a back door. Like you can stop it, you can make it better, you can turn it around. Do you understand what am I explaining that correctly?
Yeah, so I understand all the words you used. Maybe you can help me understand that a little bit more because that sounds really important.
It's very important.
So, can you give an example of a specific type of treatment and where that's relevant, what you're talking about?
Okay, so one thing really important is face and facial injections. So be sure that your provider has the medication to quickly dissolve it or make it better if they hit an artery or a vessel and they cause an occlusion. Super important things. So that's one nice little quick thing that you can ask and be confident if you're in the right place or not. If someone's going to do that, you should always have that there. Okay. Another little thing that I always do is I always have like smelling salts taped behind every single cabinet in my office, everywhere. So if you're getting your blood drawn, if you're having an IV, if the patient faints, boom, you have something to bring them back to, just like little things like that. Just be sure that wherever you go, they're prepared for whatever can possibly happen. That's it. Whether it's to me or to anyone else, those are really pretty safe things to look for.
Anything else that I need to prepare for before walking through the front door?
No, actually, no. Just be open, be ready to learn about, and be open to changing and feeling unbelievably new, honestly. Yeah,
Okay.
we have a lot to offer.
Okay. So if I, Michelle, need one of the treatments that is going to be costly, am I paying for it all up front? Is there an opportunity to pay over time? How does that work?
We do have financing. So we do take Care Credit and Cherry and I believe Affirm. So we do have financing present in the office for that.
Okay. So again, thanks for doing this. So much information. I know we only touched on a handful of the many different types of treatments or procedures that are available. I've actually been to the website and saw. I recommend folks go there if they have some questions about all the different things that are possible. But it all really starts with a consultation. So you've talked about how important that is. How long does that take? Is it a 5 minute consultation or?
Expect to spend about 30 minutes, 30 minutes for a serious consultation. And that should give you enough time for me to talk to you, to get to know what your needs are, and then to just go over some treatment options. So it's not super lengthy, but you need to give me a little time. 10
Okay.
minutes probably isn't going to be enough time for you, but at least a half an hour.
Okay. Okay, so just a couple more questions. So what does the future of Fun Aesthetics look like? What are your plans in terms of, is it growth? Is it more different types of technologies or treatments? What do you envision for the future?
You know what? For the future, I want to continue to build a strong team. I want to continue to bring the best services here to my men and women in Riverside. And I hope that I continue to instill more confidence and more just self love in my patients. That's what I'm hoping to do. I love to serve. I also teach out there in Riverside and I participate in free clinics and, giving healthcare where I volunteer my time and teach on the weekend. So that's my total goal is to serve and just to help others, honestly.
Okay, so let's talk about Serve really quickly.
Okay.
You mentioned that you like to teach and perhaps provide some levels of different types of services out in the community. Are there other community organizations or events or things that you participate in that we should know about?
Actually, yes. I have been on the Riverside Community Health Foundation board for many, many years, probably 10 years or more. So I've been very involved with them. I am on the executive board right now, board of directors as we speak. And for those that don't know about Riverside Community Health Foundation, it is the largest foundation in Riverside that actually pours money into healthcare for Riverside. A lot of great programs for children, for preventative medicine. So it does a lot of good here in Riverside. And I'm proud to be a part of that organization.
Okay. Well, thank you for your service. The community certainly benefits from the good work that they do there, and that's a leadership role. So thanks for that. So let me ask you one final question. And No is a perfectly acceptable answer to the question. That being said, Michelle, is there anything I didn't ask you that I should have?
Yes, you did not ask me about my family. So I am a proud mom of two wonderful, amazing children. So my son is 21. He goes to school at La Sierra University. He will graduate this June 14th with his biochemistry degree. He's pre-med, so he's hoping to be a physician. And then I have a daughter that's 16 and a half. She goes to Woodcrest Christian and she'll be graduating next year. And that has been probably next to my practice, my most important job and endeavor in my life are my children.
Excellent. Well, I'm glad you could include them. I'm sure they'll
Thank
appreciate that too.
No, probably they won't appreciate it, but I said it. They hate for me to post them, talk about them, anything.
Well, you didn't mention their name, so as far as we're
Yeah,
concerned,
exactly. Yeah,
yeah,
no,
yeah, nobody's the wiser. So,
right.
Michelle Garcia, owner and founder of Fun Aesthetics, I very much appreciate the time you spent with us. It's been informative. And I think my takeaway from this is that no one can know enough to have any certainty in terms of what they need for their treatments, for their issues that they may have. And it all seems to stem from the consultation and having a chance to talk to a professional like yourself who can be trusted, that has longevity, a staff that's been on for years. So it's a real honor to talk to you. Thank you.
Thank you so much. Thank you. I appreciate it.